Here we have supine knee cars. I'm going to flex my hip up as much as I can. And as I'm doing this, all I'm going to do is bend and extend my knee. But as I'm bending and as I'm extending, my foot is either turned in or turned out. And what I'm doing there is called internal and external tibial rotation. And so the knee definitely rotates, and so we're demonstrating that with the internal and external tibial rotation, and it also flexes and extends. So you can perform these supine knee cars, or you can do these standing or sitting. After that, I like to just rinse it out with some ankle cars and get ready for my internal rotation tibial pails and rails. What I'm going to do here is take my right hand underneath my right calf and reach across and hold on to my elbow and tricep. My left hand is going to hold on to the outside of the upper portion of my right foot here. I'm going to relax my opposite leg while I'm passively stretching. Inhale for 4, exhale for 8. And then I'm also going to lean against the wall just so I don't have to worry about anything but this foot and knee and shin here. So what we're going to do is we're in internal rotation, inhaling for 4, exhaling for 8. And then what we'll do is start our pals contraction in a little bit. When we start our pals contraction, what we're going to do is try to push the foot outward. So we're trying to go against the hand that's gripping on, and you're going to grip a little bit harder, and you're going to progressively contract an isometric contraction. Ready and go. From 0% to 10%, from 10% to 15%, from 15% to 20%, from 20 to 30%, from 30 to 35%. Begin irradiating by recruiting muscle from the entire body. Squeeze everything. And go from 50 to 100% of your safest and greatest effort. 5, 4, 3, 2, 1. And then from here, what we'll do is we'll try to lift away, go in the same direction as you were going before, but you're going actively and isometrically contracting the entire body while we're doing this. Keep going. This is our rails contraction, staying in internal rotation and going deeper into internal rotation. And then after that, we would just passively stretch that foot again, maybe kinetically go back and forth, and that would be internal rotation tibial pails and rails. From here, we're going to go external tibial pails and rails. You're going to feel this more on the medial side of the knee. I've had knee surgery before, and this is one of the best rehab post-injury exercises I've ever performed to really bulletproof that knee. We're going to passively stretch in external rotation. The same-sided right hand is holding on to the inside of the upper portion of the foot, while my left hand is holding on to my elbow. I'm going to hold this position passively, like I said. Inhale for 4, exhale for 8. Just relaxing and getting comfortable. Now, you shouldn't feel any pain. If you feel any pain, go before the pain. And what I mean by that is go up to the point of where you feel like there's a stretch, but there's no pain. So don't go into any pain for your passive range, your active range, or any range, okay? So the more pain you go into, the more inflammation, the worse it's going to get. So we're going to hold this passively. Keep breathing. This is external tibial rotation. And then again, pals contract 0 to 10%. Press the foot into the hand into the foot. From 10 to 20%, 20 to 30%, 30 to 40%, 40 to 50%, and then 50 to 100 of your safest and greatest effort, pressing back without any pain. Press, press, press. 5, 4, 3, 2, and 1. Rails. We're going to go deeper into external rotation. Lift the hand away. Actively go into external rotation. Keep everything tight. Keep squeezing everything. Trying to go outside. Turn that foot out. Keep going. 3, 2, and 1, and relax. Passively stretch. Kinetically go back and forth. And that will complete our internal and external tibial rotation pails and rails. And after that, I like to perform some Patella CARS. All I'm doing here is taking my 2 thumbs, gripping the outside and inside of my knee, and pushing the patella in a 360-degree fashion. I'm going all the way up from 12, 3, 6, 9 to 12, and then about 3 to 6 one way and 3 to 6 the other way. and just seeing if there's any pain. This is the only time I'm actually going to relax my entire body, and I just want to know that I have full control of that patella. Now if the patella doesn't move, if you're not able to move that patella, that's going to tell you something. It's showing you that you have some issues, that you definitely need to get that checked out. Also, if there's any pain, you can passively press into that area for an extended amount of time, and that's it. So we went over knee CARS, knee PAILs and RAILS, and Patella CARS. Thanks a lot. If you're looking for more information, check out my YouTube page and the link in my profile. Look at my morning mobility routines you can follow. That's going to set you up for assessment. And then if there is anything you need personally, you can DM me. If you'd like to find someone in your neighborhood or area that you can see one-on-one, check out functionalrangeconditioning.com. functionalanatomyseminars.com, and click find a provider, or try to get certified. It's a very good CEU to have under your belt if you're in the health and fitness profession, and I see it as beneficial for all individuals, regardless of training ability, training styles, and training methods. Thanks.